It was announced on Monday, and it finally came into play. Public Health's new strategy to test those who are symptomatic and high-risk close contacts seems to be working. Public Health PIO Janela Carrera was at the test site today and gave KOAM the latest on the testing situation.
Even starting yesterday, we saw the line kind of start to shorten a little bit, and then today it was a lot smoother. So, I think what it is the community heard our call. They responded very well. They're taking it very well. The business community, local government agencies, the school community as well, and just the community at large. They recognize this need to open up that line to those who really need to get tested, which is, of course, those who are symptomatic, those who meet the criteria for getting tested if they have a work exposure or household exposure, and those are the high-risk close contacts.
As we reported, the Tiyan testing site, as well as the northern and southern community healthcare centers, will be prioritizing residents who need to get tested the most. These include those 65 years and older, unvaccinated or not fully vaccinated, those with multiple comorbidities or underlying health conditions, and those who are moderately to severely immunocompromised. In addition to the Tiyan testing site and its various partners, a brand new testing clinic opened up today run by Dr. Berg.
That site is run by Guam Radiology Consultants, and we're doing that for several reasons. The demand here in the building where we're located grew rather rapidly, and we wanted to be good neighbors to the other healthcare providers in the building who were having difficulty with their patients getting parking. Plus, it was a little more difficult when those who were coming for testing were wrapping around the building. So we looked for another site, and we were able to secure the site across from Ocapeles. That site is easier to organize, and I think easier for people coming in for testing.
Since the Tiyan test site is only taking in those who are symptomatic and high risk, Dr. Berg assures residents that the one run by GRC will accept both symptomatic and asymptomatic patients.
What we're doing is following a policy of community involvement with judicious use of the supplies that are present on the island. And what that is the process is to try and encourage people to think twice before coming to get tested. No one will be turned away, no one. But we're asking people to say, if I was exposed to somebody a week ago and they were positive and I'm not at high risk, and I don't have family members that are high risk, do I really need to get tested? And it's, again, just saying, think a little bit twice because we want to make sure we're not running out of kits.
Dr. Berg added that the test kits being used at the Oka site are provided by Public Health and they are given an allotment to use for the day. The Oka test site is open from 7:30 a.m. to 2 p.m. Mondays to Fridays, but Dr. Berg said they are looking to expand the time and days. As for the limited supply of test kits on island, Dr. Berg confirmed that more were ordered before the supply thinned out and added that Governor Lulian Guerrero is in Washington to ensure that Guam gets its fair share of test kits. Daniel Perez reporting for Guam's News Network.